Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 97. Late-Onset Multiple Sclerosis, or for short LOMS, Symptoms, Treatment Options and Prognosis with Dr. Abdulkadir Tunç. Dr. Abdulkadir Tunç is Associate Professor at Sakarya University at the Faculty of Medicine in Turkey. And now the interview begins. Hello, Abdulkadir. It's such a pleasure to have you on the show. Hello.
Hello, Nele. How are you?
Great. How are you? And how is the weather in Sakarya?
Oh, it's a bit cold and rainy today.
Okay. Yeah, we have a little bit of snow. Before we actually start with the interview, it would be lovely if you could introduce yourself to the audience so they know who is with me on the podcast today.
Yes. Thank you for having me. It's a pleasure to be here. May I introduce myself?
Yes, please.
I am associate professor in Sakarya, near Istanbul, in Turkey, and a specialist in neuroimmunology, particularly MS and other autoimmune diseases. For over 10 years, I have been closely working with MS patients, providing care and contributing to research aimed to improve the quality of life. And I am proud to have completed the prestigious International Charcot MS Master Program, which deepened my understanding of MS and its management. Currently, I run neuroimmunology clinics at my university in Sakarya, and my team and I focus on personalized approach to treatment of MS or other MS mimickers, Beyond my clinical work, I actively participate in our national neurology study program and regularly attend international conferences to stay updated on the latest innovations in the field. On a personal note, I am married and a father of two wonderful children. When I'm not working, I find joy in playing court tennis and swimming. Activities that help me recharge and maintain balance in my life. I believe that staying active and curious, both professional and personal, is key to living fully.
Fantastic. Yes, sounds good. And that's actually how we get to know each other, because you are studying, or you finished already, the English version of the Multiple Sclerosis Master's Program. And I do the German. I still have to do the master thesis. So lucky you when you have already finished. What was your personal motivation for your career choice?
Actually, my motivation to pursue a career in neurology, particularly in the field of neuroimmunology, stems from a deep curiosity about the complexities of the human brain and nervous system. Early in medical training, I was drawn to how neurological disorders can profoundly impact a person's life and the lives of their loved ones. This inspired me to focus on conditions like MS, where I felt I could make a tangible difference. What solidified my commitment was meeting MS patients and seeing both the challenges they face and their incredible resilience. Every patient's journey is unique, and I find great fulfillment in helping them navigate these challenges while also working on advancing treatments to improve their outcomes. On a personal level, I have always inspired by the idea that science and empathy go hand in hand. By building strong connections with my patients, I am reminded daily why I choose this path. To not only treat this disease, but to understand the person behind it. This combination of science, innovation, and humanity keeps me motivated every day.
Very good, yes, and I can totally understand your choice. So today we want to talk about the late-onset multiple sclerosis, the so-called LOMS. How is it defined in terms of age at diagnosis?
Well, there are different definitions. Late-onset multiple sclerosis, LOMS, refers to MS diagnosed at the age of 50 or older. While MS is commonly recognized as a condition affecting young adults, LOMS highlights that this disease doesn't adhere strictly to age boundaries. In fact, growing awareness and improved diagnostic tools have helped identify LOMS more frequently. This age-specific classification emphasizes the unique challenges and experiences of older adults diagnosed with MS.
Okay. How does LOMS differ from early onset MS in terms of symptoms, progression, and overall impact on daily life?
LOMS often presents with more motor symptoms like weakness or difficulty walking as the first sign, whereas younger patients might initially notice vision or sensory changes. The progression of LOMS tends to be faster, with a higher likelihood of developing a progressive disease course, such as primary progressive MS or secondary progressive MS. This is likely due to factors like aging and immune system change, which reduce the body's ability to repair nerve damage. In daily life, older adults may face greater challenges in managing MS due to comorbidities like hypertension or diabetes. This can complicate treatment and lead to delays in diagnosis. Additionally, physical disability measured by the EDSS tends to progress more rapidly in LOMS patients, affecting mobility and independence.
Okay. Are there any specific factors that contribute to a later onset of MS, or is it typically a matter of delayed diagnosis?
Yes, there are several factors contribute to the later onset of MS. Aging-related changes in immune system, known as immunosenescence, may play a role in triggering the disease later in life. Comorbidities such as vascular or metabolic conditions may also increase the risk. However, delayed diagnosis is common due to overlapping symptoms with other age-related conditions like stroke or arthritis, making MS harder to recognize initially. Moreover, older patients are less likely to participate in clinical trials, which contributes to uncertainties in recognizing and treating LOMS effectively. Despite this challenge, timely diagnosis and appropriate treatment remain critical to improve outcomes for LOMS patients.
Yes, thank you. You were already teasing the treatment. Are there certain immunotherapies more or less suitable for LOMS patients due to the aging immune system and the risk of side effects?
Yes, absolutely, yes. The treatment of LOMS requires a personalized approach to consider the unique challenges of immune system and the patient's overall health, comorbidities, and other characteristics. While injectable treatments like interferons or glatiramer acetate have historically been considered safe, they are not commonly used as a first-line option for LOMS due to, for example, tolerability issues. Instead, the recent trends favor oral therapies such as limited fumarate or teriflunomide as initial treatment choices. These medications are generally well tolerated and convenient for patients, making them a suitable starting point in many cases. For patients with aggressive disease or signs of progression, anti-CD20 agents like ocrelizumab or ofatumumab have become a preferred option. Its effectiveness in controlling both relapses or disability progression make them valuable choices, especially in cases with poor prognostic markers like, for example, multiple spinal cord lesions or higher lesion burden or evidence of brain or spinal cord atrophy. Additional factors influencing therapy selection include gender, smoking, oligoclonal band positivity, or other the recovery after first initial pulse steroid treatment. However, therapies like alemtuzumab and natalizumab, while effective, require careful management of risks, including infection and other immune-related side effects. These treatments may still be considered for select patients where the potential benefits outweigh the risks, but they demand vigilant monitoring. In summary, the choice of immunotherapy in LOMS is highly individualized, balancing the patient's clinical profile, disease activity, and lifestyle needs to ensure both safety and effectiveness.
Fantastic. Thank you. Yes. And I think that is something that is always important with MS. You have to find a choice that really works with that patient in front of you sitting. How do the body's natural repair mechanisms like remyelination differ in older patients with MS compared to younger individuals?
The body's ability to repair myelin, the protective coating around nerve fibers damaged in MS, decreases with age. In younger individuals, cells called oligodendrocytes are more active and efficient at producing new myelin, a process known as remyelination. This helps limit damage and supports nerve function even after MS-related attacks. In older patients, however, this natural repair process becomes less effective. Several factors contribute to this, including aging of oligodendrocytes, which are oligodendrocyte precursors, especially, which are responsible for creating new myelin, but become less responsive and efficient at repairing damage as we age. Chronic inflammation in MS can also create an environment that hinders remyelination, a problem that's more pronounced in older individuals due to an imbalanced immune system, a process known as immunosenescence. Additionally, aging tissues, including the brain and spinal cord, may have fewer growth factors and supportive structures needed for repair, and the accumulation of oxidative damage over the time further impairs the body's ability to repair itself. As a result, older MS patients are more likely to experience progressive forms of disease, where disability accumulates over time even without frequent relapses. This underscores the importance of early and effective treatment to slow down disease progression and protect nerve fibers before irreparable damage occurs.
Okay, thank you. So now that we talked about the immunotherapies, let's move on to the symptomatic treatment. How important is symptomatic treatment for LOMS, and what are the key symptoms that need to be managed?
Well, it's critically important for managing LOMS. While DMTs target the underlying progression of MS, symptomatic treatments focus on improving the patient's quality of life by addressing day-to-day challenges caused by the disease. In LOMS, symptoms can vary widely but often include mobility challenges such as muscle stiffness, weakness, or spasticity, which can significantly limit mobility and may be elevated with physical therapy, stretching exercises, and medications like baclofen and tizanidine. Fatigue, one of the most common and debilitating symptoms, can be managed through energy conservation strategies, exercise, and medications like amantadine and modafinil. Neuropathic pain, including burning and tingling sensations, is also prevalent and may be treated with medications like gabapentin, pregabalin, and antidepressants such as amitriptyline. Bladder and bowel problems such as frequent urination or constipation can impact daily life and may require dietary adjustments, pelvic floor therapy, and specific medications. Cognitive impairment, including memory or focus issues, can be addressed with cognitive training or adaptations to daily routines. while mood changes like depression and anxiety benefit from counseling, support groups, or antidepressant treatments. For LOMS patients, managing comorbidities like diabetes or hypertension is also crucial as these can exacerbate MS symptoms. Tailored rehabilitation programs that integrate physical, occupational, and speech therapy further enhance overall function and independence. In summary, symptomatic treatments are not just an add-on, but a cornerstone of managing LOMS, enabling patients to maintain independence and improve their quality of life.
Absolutely. So what is your opinion on that? What role do physical rehabilitation, or not, not your opinion, but the opinion of the wider MS community, what role do physical rehabilitation, cognitive therapy, or other non-drug treatments play in the management of late-onset MS?
Non-drug treatments play a vital role in managing LOMS, complementing medications to improve both physical and mental well-being. These therapies address the unique challenge faced by aging MS patients and play a crucial role in improving quality of life. Physical rehabilitation is vital for maintaining mobility, strength, and balance, especially in LOMS, where age-related muscle weakness and stiffness can worsen mobility issues. Targeted exercises improve flexibility, reduce spasticity, strengthen muscles for daily activities, and enhance balance to minimize fall risks. While assistive devices like cans or braces can improve safety and independence. Cognitive therapy addresses challenges such as memory loss or concentration difficulties through strategies like using memory aids, practicing exercises to enhance attention and decision making, and building resilience to reduce anxiety about cognitive decline. Regular mental stimulation through activities like puzzles, reading, or learning new skills is also beneficial. Occupational therapy focuses on adapting the patient's environment and routines by modifying home layouts for accessibility, suggesting tools like grab bars or ergonomic utensils, and teaching energy conservation techniques to manage fatigue. Mind-body therapies such as yoga, tai chi, and mindfulness meditation help reduce stress, improve flexibility, and enhance well-being, particularly for managing fatigue and mood changes. Social and emotional support is essential for combating the isolation often experienced by older MS patients. Support groups, counseling, and family involvement help alleviate loneliness, depression, and anxiety, while engaging in hobbies or community activities fosters social connections. Nutritional counseling further supports overall health and by promoting a balanced diet rich in anti-inflammatory foods and addressing specific concerns like weight management and or vitamin deficiencies with guidance of a dietitian. Together, these therapies form a holistic management plan that addresses both the physical and emotional dimensions for living with LOMS, empowering patients to actively participate in their care and improving their quality of life.
Yes, and improving the quality of life is so important. And what you just all mentioned, I mean, really please out there, you listener, it's really important to use all and each puzzle piece to improve, or let's say to keep that level that you have, and really use all options to treat MS. So what is the typical prognosis for patients with LOMS compared to those diagnosed at a younger age?
Well, the prognosis for patients with LOMS often differs from those diagnosed at a younger age. Generally, LOMS patients are more likely to experience a faster accumulation of disability and a higher prevalence of progressive disease forms such as PPMS or SPMS. This is partially due to an age-related factor such as reduced capacity for remyelination or other repair mechanisms, as well as comorbid conditions. which can worsen symptoms and complicate management. However, it is important to note that with appropriate and timely treatment, many LOMS patients can achieve good control of their symptoms and maintain a high quality of life. Early diagnosis and effective therapies play a critical role in slowing disease progression and preserving function.
Okay, yes. You already said that LOMS normally progresses faster than early onset MS, and are there any predictors of disease progression in this age group, besides the one you just mentioned?
Yes, it progresses faster. This accelerated progression in LOMS can be attributed to the reduced repair capacity, and which becomes less effective at repairing damage caused by MS. Several factors predict faster disease progression in LOMS. Patients with significant spinal cord lesions are more likely experience rapid disability accumulation. Poor recovery after initial therapy is a marker, and other biomarkers such as oligoclonal band positivity, higher IgG index in cerebrospinal fluid indicate heightened immune activity and greater disease activity. Age diagnosis plays a critical role, and comorbidities and smoking further exacerbate symptoms and increase disability risk. Despite this challenge, advancements in DMTs have significantly improved outcomes for LOMS patients. Medications like ocrelizumab or cladribine are particularly effective in slowing disease progression, especially in cases with aggressive diseases.
Okay, and at last ACTRIMS, we heard quite some good news about the BTK inhibitors. Do you think the BTK inhibitors could be a preferred option for immunotherapy in LOMS?
Yes, BTK inhibitors represent a promising new class of immunotherapy for MS, as well as for LOMS. These medications work by selectively targeting B cells, which play a crucial role in inflammatory processes of MS. BTK inhibitors offer several advantages that make them an appealing option for LOMS patients. One key benefit is their oral administration, which eliminates the need for injections or infusions, providing greater convenience and improving treatment adherence. Additionally, BTK inhibitors have a targeted mechanism of action, selectively modulating immune pathways to reduce inflammation without broadly suppressing the immune system, which may help lower the risk of serious infections, a significant concern for aging patients with immunosenescence. Emerging research also highlights their potential neuroprotective effects, suggesting they could slow the progression of neurodegeneration, a common challenge in LOMS. Although still under investigation, BTK inhibitors may become a preferred option for LOMS patients, especially those with active disease or who cannot tolerate other treatments due to side effects or comorbidities.
Yes, you just mentioned the important word tolerability. How do BTK inhibitors balance effectiveness and tolerability for older patients?
These therapies effectively reduce B cell activity, addressing both anti-inflammatory and neurodegenerative aspects of MS. Their ability to penetrate the central nervous system allows them to directly target inflammation within their brain and spinal cord, which is crucial for slowing disease progression. In terms of tolerability, BTK inhibitors may cause fewer systemic side effects compared to some existing therapies, since they do not fully deplete B cells. As oral medications, they also avoid injection-related reactions or infusions-associated side effects, making them more user-friendly for older patients. Additionally, early studies suggest that BTK inhibitors have a manageable safety profile, even for individuals with comorbidities, although careful monitoring is necessary to detect potential side effects like mild gastrointestinal issues or rare immune-related complications. In summary, The BTK inhibitors show great promise in effectively managing LOMS while offering improved tolerability for older populations. Of ongoing trials confirm these advantages. They could become a valuable option in treatment landscape for LOMS.
Fantastic. Abdulkadir, so we are coming to the quickfire Q&A session. Complete the sentence. For me, multiple sclerosis is?
For me, multiple sclerosis is not just a disease. It's a puzzle we are solving every day, unlocking new ways to empower patients and transform lives.
Yes, that's a nice metaphor. What development would you like to see in the field of multiple sclerosis in the next 5 years?
Well, I would love to see breakthroughs in precision medicine for MS, therapies tailored to individual patient profiles, including advanced biomarkers to predict disease activity and progression. I also hope for the widespread implementation to neuroprotective treatments and technologies like artificial intelligence-assisted diagnostics to improve early detection and long-term outcomes.
Yes, that would be lovely. Finally, what message of hope or encouragement would you like to share with individuals living with MS?
To everyone living with MS, remember that you are not defined by this disease. Each day, we are making progress in understanding MS and developing new treatments to improve lives. Stay hopeful, stay proactive, and never hesitate to lean on your support network. Together, we are stronger, and together, we will continue moving forward.
Yes, absolutely. And staying active is really so important. How and where can interested people follow your research activities?
Well, they can follow my research and updates through academic platforms like ResearchGate or LinkedIn, where I share my latest publications and projects. I also collaborate with MS-based registry and participate in international MS-focused events. So stay tuned for updates from these communities as well.
Fantastic. Yes. And of course, I will link it in the show notes. Abdulkadir, thank you very much for your insights into that important topic of LOMS, late onset MS. And I hope to meet you at one of the next spectrums. And yeah, thanks a lot and take care. Bye-bye.
I hope so. Thank you for the invitation. Have a nice day.
I hope you enjoyed the interview and learned something new about LOMS and how to treat it. By the way, next time there will be another Actrum special episode, this time about new research for managing primary progressive multiple sclerosis, which is known as PPMS. So this will be interesting, and I know there's not so much research ongoing as there should be, but at least it is more and more happening. So please tune in again and stay as positive and healthy as possible. And see you next time. Bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.